How we doing today, class? My name is Joe Carpenter, and we are currently in the winter semester of 2021 for the First Aid and CPR course at Jackson College. Now, for this course, I've chosen to do a presentation on depression because depression actually affects me personally, as well as a vast amount of people in the American population. According to the Biology, the Core by Eric Simon, depression actually affects over 20 million Americans, with a majority of them being female. I also chose depression because I just feel that there's a stigma around mental health, or there has been for a long period of time. And just recently are we breaking out of that stigma, bringing depression to the light, being able to communicate about it, better understanding it, and better knowing how to help alleviate the causes and the effects of depression. So with that being, let's dial into depression. Now, depression actually affects the central nervous system. So we're dealing with chemical imbalances in the brain. These chemical imbalances can cause these neurotransmitters in your brain to fire in different pathways. There's like I say, an imbalance of the release of serotonin and dopamine and epinephrine. So when depression is building or coming on, that's the chemical imbalance that we're talking about. Now, because depression is so unique, it actually deals with us psychologically and biologically. Biologically being that it has that chemical imbalance that we're talking about. There are chemical releases in the brain or less release in the brain. It's that imbalance. Psychologically, we are dealing with the brain. We're dealing with thoughts, responses, reactions to outward circumstances in our world. We can relate it to being rather than trauma related, we would deal it more medically related. It's a behavior issue. So we would respond to depression a little bit more along the medical guideline than the trauma timeline, but there is still a bit of trauma that could be involved with depression. Now, signs and symptoms of depression deal mostly with mood, whether it be mood swings, downcast moods, maybe apathy towards things or relationships or hobbies that we once cared a lot for, that we once paid attention for. Other signs of depression could be suicidal thoughts or suicidal tendencies. That might be more along the lines of what we're going to approach when dealing with somebody who has depression. Now, when I stated that depression has affected over 20 million Americans and a majority being female, the chart here does show suicide rate in relation to age. Now, along the bottom here is ages split up. We have 10 to 14, 15 to 24, all the way up to 75 and over. Now, the pink color is actually suicide rate of females, and the blue is suicide rate of males. So, yes, while most females suffer from depressive moods or depression in itself, it seems to take a toll on males more, with their suicide rate being more than double that of females. Why that is still in research and still in study, but this does come from the Essentials of Psychology by Mr. Naveed. Now, when we're going to care for depression, and when we're, let's say, arriving on the scene or noticing these signs and symptoms of a depressed person, again, we would probably follow the medical assessment for somebody who is depressed because, again, of that behavioral change or behavioral outbursts or mood or things of that nature. Where we step in is probably going to be more of the suicidal tendency or suicidal thought, or those mood swings, of course. Now, when we show up, we would make sure that the scene is safe. right? Making sure that there's no weapons around, possibly making sure that we're not on an elevated platform, assessing the scene, making sure it's safe, of course, and then following the medical assessment from there. Now, when dealing with someone who has suicide, the care and the prevention really goes hand in hand, unlike maybe a cardiovascular issue or somebody who may be unresponsive. A lot of times we're going to be dealing with a depressed person who is responsive, who can communicate what they're going through with someone who arrives on the scene of a depressed person. Now, some of the preventive things and some of the care that we can take if we are depressed or if somebody else is depressed is making sure that they have support, knowing that we're there to walk with them. They have a support structure, they're not alone. Also, meditation and breathing techniques, maybe finding breath work or being more in the moment. Now that's something that's worked for me when we're getting anxious or our heart rate rises with a depressive episode. If we're focusing on the here and now with breathing techniques or meditation, that can help take us out of the thoughts of the past or the anxiety of the future. I've also found that certain hobbies like exercise, painting, different art forms, or even journaling have all been proven to help subside the effects of depression. Now, one of the other care techniques of depression could be medication. Seeking a professional in therapy or counseling, along with medication, can help alleviate the effects of depression. It can help take those neurotransmitters in our brain and help that chemical imbalance bring us back to kind of a base level where the uptake in serotonin starts to become more leveled out, as well as the releases of dopamine and epinephrine like we stated before. Now, when it comes to depression, I hope that you have a better understanding of the signs, the symptoms, what is really happening in our body or somebody else's body, and the things that we can do to help care and help support ourselves or someone else going through depression. With that, I really appreciate you listening. I hope this helps you better understand depression, and I do hope that you have a successful rest of your semester and rest of your college career. Have a great one.